Welcome back to the Fertile Ground podcast, where we talk to fertility specialist and obstetrician Dr Jyoti about all things fertility and pregnancy. Today, we're addressing some of the burning questions Dr Jyoti gets asked from women about taking medication during pregnancy. What's safe and what's best to be avoided. Dr Jyoti, welcome back to another episode.
Thank you.
I wanted to sit down today and talk to you about medication you can take or not take whilst you are pregnant.
That is a great topic.
Because you've got all these wonderful obstetric clients now and you're taking care of their babies, and future mums and mums can have questions about this because people get sick.
Absolutely.
So what about the most common ones? That pain relief, Panadol, antihistamine, cold and flu, what type of stuff can and should we avoid?
So I think the most important thing to remember in pregnancy is pain relief can be taken. There are various forms of pain relief, but everyone has a couple of different forms of pain relief at home. Usually everyone has something like Nurofen or Advil, which we class as anti-inflammatory or non-steroidal anti-inflammatory drugs. And mostly everyone also has Panadol at home. We don't recommend that you use anti-inflammatory drugs in pregnancy. They're actually, they can adversely affect the baby's kidneys. So we'd prefer you use something like Panadol, which is very useful for simple pains, things like back pain, pelvic pain. If you happen to have fallen over and hurt your ankle, simple pain relief through Panadol is very, very safe as long as you take it as instructed. And if you have severe pain in pregnancy, we can prescribe other forms of pain relief that are also very safe. So things like Panadine Forte. There are other combinations of Panadol and codeine, things like Prodein. And then there are very strong opiates that we can still prescribe safely in pregnancy for very severe pain. Things like morphine and pethidine are actually also safe. We just worry about long-term use of very strong pain relief. Things like Panadine Forte can form a dependence and can cause withdrawal in the baby if it's used for too long in pregnancy. So we just judiciously prescribe those things as needed.
But for those women out there that are pregnant, these things are allowed?
Absolutely, absolutely.
Because you do hear about women during pregnancy not wanting to take any medication for any reason, and they don't need to do that, is it?
That's absolutely true. In fact, a lot of women will feel very guilty about having to take medication, but all of these medications that we prescribe and persuade women sometimes to take for their own sakes is very well studied in pregnancy. So there's a long-standing safety information available.
So I've got a little list of other things here that I want to just ask you about. The next one on my list is reflux.
Reflux is so common in pregnancy, usually towards the end of pregnancy, but it can also be accompanied when some women suffer from really severe nausea and vomiting in pregnancy. They can also get very severe reflux, and there are some very safe medications that we can recommend for use in pregnancy. And some people may be aware of their brand names, things like Zantac, things like Losec, which is omeprazole, things like Somac, and now Nexium is actually been used very safely in pregnancy as well.
And is the reason for that just that you're running out of space in your stomach?
I think some of it is definitely compressional. So when the pregnant uterus gets bigger and heavier and the baby grows, then there's more pressure, upward pressure on the stomach. So there is also the production of a lot of progesterone in pregnancy, and that relaxes the esophagus and the little sphincter that actually helps keep the acid in the stomach relaxes as well. So women more readily get reflux in pregnancy, particularly towards the end of pregnancy.
I've heard plenty about that one. Yeah. One that is probably never going to leave the news cycle, but COVID, how does that affect pregnant women?
COVID is a very good question, and I suppose we've had the pandemic and a lot of women have experienced COVID outside of pregnancy or of known pregnant women with COVID. So now we have the benefit of a lot of information that's come out of COVID and how that might affect pregnancy. Luckily, COVID can be very mild in pregnancy now because most people have been vaccinated against COVID and they've had multiple vaccinations now. So COVID tends to be mild, but if it does become quite severe, it's usually in the third trimester of pregnancy when the baby's much bigger. It's more difficult to get a deep breath in pregnancy, and so it can compromise some women's lung function and can force us to think about delivering their babies earlier to help their general health.
Yep.
So COVID, generally speaking, hopefully wouldn't significantly impact a pregnancy, but it may cause a fever or temperature, in which case take some Panadol. It's important to keep your temperature down in pregnancy and try and keep it in the normal range. And the other thing that COVID can be associated with is growth restriction in the baby. So regular growth ultrasounds through a pregnancy that's been affected by COVID is also really important.
Cool. And the regular medications that a non-pregnant person would take are the same things that you would take. So your pain relief, your...
Yes, just
there's not much you can take anyway.
Unfortunately, with viral infections, there isn't a lot that you can take. There are some antiviral medications that are available for if we think a pregnant woman might be severely compromised in terms of her immune system. So if there are other things going on with that pregnant lady, then maybe those medications might be suitable for them.
But that's a conversation individually.
Absolutely. That's a very individual conversation.
Of course. And then the next one I wanted to discuss was medications regards people's mental health. So if you have any medications for anxiety, depression, etc., how does that come into play?
Well, our general advice is obviously trying to look at those medications before someone has a pregnancy and trying to minimise the amount of medication that they're on, but still obviously keep their mental health in good shape. So sometimes there's more information in pregnancy about certain medications to do with mental health, particularly around anxiety and depression. Some of them are really well studied. Some of the newer medications might not be as well studied. So it might be worthwhile sitting down with that person and going through their medications, seeing if they really need it. And if they do, then it is much safer for that person to continue those medications through pregnancy. And usually we can provide them with the information that we've gathered over the years in terms of women who've had babies and stayed on that medication through pregnancy and even whilst they're breastfeeding. So there's a lot of safety information around a lot of those medications that is very reassuring.
And when you have a patient that is on mental health medication, is it a conversation with their psychiatrist, psychologist, GP?
Absolutely. I think it's important for all of us to actually talk to the patient and talk to each other to understand whether we can modify the amount that patient is on, whether we can change the medication safely, or whether we're actually jeopardising that person's mental health by taking them off that medication, particularly if it happens very suddenly. And pregnancy can be very stressful, particularly the post-delivery period where you've just had your baby. People can develop postnatal depression more easily. So all of those considerations need to be talked through with the patient, either before pregnancy or early in pregnancy, so we can help them understand the importance of perhaps staying on their medication if they need it. It's far more dangerous to stop medication in some cases. So yes, absolutely talk to your GP, talk to your obstetrician, talk to your psychologist or psychiatrist before you suddenly stop taking your medication just because you're planning a pregnancy.
Yes, I think that's really important thing to think about and talk about. One of the other really common things that happens every year, hopefully for everyone, is they visit the dentist, and there's medication involved in a dental appointment often. How should someone who's pregnant approach a visit to the dentist?
I think I get a lot of calls from my my pregnant patients when they're about to visit the dentist, and we know that dental emergencies are just that. They happen out of the blue. You can crack a tooth, you can develop a dental abscess, you can require a filling, and sometimes that coincides, unfortunately, with pregnancy. It's not uncommon. It's very safe to go to the dentist if one of these things happen. It can be much more detrimental to the pregnancy if you don't have an infection fixed or drained. If you don't repair a tooth and you develop an infection, that can put a woman at greater risk of preterm birth. So it's important to see your dentist. Be confident that your dentist actually is very familiar with pregnant women and dentistry work in pregnancy. They are very familiar with what they can and can't give pregnant women in terms of local anaesthesia. But I'm always very happy to talk to my patients and reassure them about their next dental visit. And it's really important to keep your regular dental health hygiene checks through pregnancy or before pregnancy, because we do know that dental health can affect your ability to get pregnant and stay pregnant.
Good to know. So can I get local anaesthetic when I'm pregnant?
You absolutely can. Often with the dentist, they will add another medication called adrenaline, and that reduces bleeding. Generally speaking, we don't like that given in pregnancy. That may affect blood supply to the baby through the placenta. So we'd prefer them not to use the adrenaline unless there's a very good reason to. And again, dentists are very aware of not giving that.
Can I have the happy gas when I'm pregnant?
You certainly can.
Oh, good.
You certainly can. That's completely safe. It's a very fast-acting form of pain relief.
I haven't had it before, but I've got a couple of relatives that swear by it. Yeah.
Well, I haven't tried it myself, but I've certainly watched pregnant ladies try it in labour, and it's a good form of pain relief. It's quickly expelled from the body, so it should be completely fine to have in pregnancy as well. So I think that the other common question is antibiotics. In pregnancy, especially at the dentist, because obviously if you develop an infection in your tooth, the dentist's going to prescribe some antibiotics. So there are many antibiotics that can totally safely have in pregnancy. There are some that we actually strictly do not use in pregnancy. So again, it's always worthwhile checking with your GP, with your dentist or with your obstetrician whether or not it's safe to take that antibiotic. Almost all of the time it's safe. There are very rare exceptions to not using certain antibiotics in pregnancy.
Well, I think we've covered lots and lots of illnesses
Yes.
that hopefully no one has to deal with. But it's really good to know. What's the general piece of advice for if you have a question about medication that you're taking?
I think that call whoever is looking after you during your pregnancy, whether that's your obstetrician, your GP, your midwife. Most of us are very familiar with the everyday medications and their safety. Sometimes if it's a more specific medication, even your obstetrician or your specialist may actually need to check up on the available data to see if it's actually safe in pregnancy and to continue it in pregnancy. If there's any doubts, usually we try and find a safe substitution for that medication.
Lovely. Thanks for your time, Dr. Jyoti.
Oh, you're very welcome.